Today, we're sharing a saga of mergers, board seats, family ties, and state-level lobbying efforts. In the annals of Huntington's medical history, Cabell Huntington Hospital stands as a monumental institution, tracing its roots back to its inception in 1956 as a joint venture between Cabell County and the City of Huntington. However, the hospital's trajectory took a significant turn in 1988 when it transitioned into a private nonprofit entity without compensating Cabell County taxpayers who had initially funded its establishment. This transition, purportedly driven by competitive needs, saw the city and county each wielding the power to appoint 3 board members to the newly privatized institution's 12-member board. Fast forward to 2018, and Cabell Huntington Hospital had burgeoned into a medical powerhouse, enough to orchestrate the acquisition of its rival, St. Mary's Medical Center, after protracted negotiations with the Vatican and the Federal Trade Commission. Yet, amidst the fanfare of this merger lay a discordant note. An attorney representing Cabell Huntington Hospital at the time assured the citizens that St. Mary's would retain its full-service status post-acquisition. However, the hospital's subsequent decision in 2022 to discontinue child delivery services at St. Mary's, redirecting patients to Cabell Huntington Hospital, broke the social contract and meant the realization of a key concern of the FTC, the loss of service diversity and capacity. This has led many to fear the further loss of local services while putting the integrity of the hospital's other statements in question. Moreover, the post-merger landscape witnessed a pivotal shift in governance dynamics. The hospital conglomerate sought control of the board seats previously allocated to the city and county after the hospital's conversion to a private entity, offering a financial exchange of $1 million to each entity. The county commission's approval in late 2018, followed by the city's concurrence in early 2019, effectively divested taxpayers of any substantive influence in the regional hospital they had created. One of the ardent proponents of the merger was then former West Virginia House of Delegates member, Kelli Sobonya. During her time as a delegate, she was a member of committees such as the Industry and Labor Committee, the Joint Health Committee, and the Health and Human Resources Committee, during which time she undoubtedly had frequent interactions with medical industry lobby groups and personnel. Notably, her support for the hospital merger is on record as far back as her sponsorship of House Bill 4553 in early 2016, which aimed to wrest control of hospital merger approvals from federal regulators to state health authorities. Sobonya's subsequent election as Cabell County Commissioner in November 2018 coincided with the completion of the board seat sale, which happened just days later, raising eyebrows and concerns about the impact her influence may have had on the move as she began working closely with then-Commissioner Nancy Cartmill during and after the election, with Nancy going so far as to endorse her candidacy. Additionally, our information suggests that Sobonya met with the hospital board at some point in 2018 demanding they sweeten the deal, ultimately leading to the resolution's passing. The intrigue deepened when details later emerged about her daughter's career path. Sometime between the regulatory green light for the merger in May and the release of the hospital board seats in November, Sobonya's daughter enrolled in Marshall University's Healthcare Administration degree program. Shortly thereafter, she ascended to the role of Director of Government Relations at Cabell Huntington Hospital after gaining initial employment there only a short time before and after Sobonya's advocacy for the merger. Speculation ran rife about the rationale behind the swift hiring and promotion from assistant administrator to director, particularly considering her mother's advocacy for stripping taxpayers of their governance stakes in benefit to the hospital conglomerate. Further, the sudden shift in her daughter's academic focus from her previous studies in political science and international relations only added fuel to the conjectures surrounding the family's ties to the hospital's affairs. Was the promotion part of the deal struck by Sobonya following her hospital board meeting? The move would arguably have benefited both parties. Fast forward to 2024. The Hal Greer Corridor project emerges as a focal point of contention. Initiated by the West Virginia Department of Highways following lobbying efforts by Marshall University and Cabell Huntington Hospital, the project has sparked spirited discourse among local citizens because of its significant impact on travel within the city. Notably, Sobonya's daughter, in her capacity as Director of Government Relations, is purported to have played a pivotal role in lobbying Charleston for funding approval for the project. As the narrative continues to evolve, a tapestry of queries emerges, weaving together the intricate dance of political strategies, familial connections, and the public good in sculpting Cabell County's healthcare and governance narrative. With Sobonya now successfully beyond her May primary and with no Democrat challenger in the fall, all eyes remain vigilant for further developments involving these pivotal figures. It's clear that the intersection of entrenched power, hidden relationships, and community interests will continue to shape the landscape of healthcare and governance in Cabell County for the foreseeable future.